here we go.
Okay, so I'm going to be doing chrysanthemum poisoning in dogs. I'm doing this because I actually had an incident with this with my dog. He's a black lab, so they're notorious for getting into everything. And so some of the things that chrysanthemum is in includes household insecticide sprays, ornamental outdoor pesticides, roach sprays, ant sprays and granules, hornet sprays, lice treatments, commercial and building insecticides, and then, so there's some pictures. And my dog, he actually ended up like eating half a bag of fire ant killer. So, I'm from Texas, so fire ants are a big problem. So what makes chrysanthemum poisoning, what makes chrysanthemum poisonous for dogs? Pyrethrins are derived from chrysanthemum flowers, and those are typically used in natural pest control or insecticidal products. However, they are considered fairly toxic in large amounts. Pyrethroids are a synthetic version of pyrethrins that are chemically engineered to be more toxic with longer breakdown times and are often formulated to increase potency. Doing this compromises the human and animal's body ability to detoxify the pesticide. And then pyrethroids are considered neurotoxins, and they affect the nervous system and the permeability of nerve membranes. Causes of chrysanthemum poisoning. So most of the time in dogs, it's because they ingest too much, whether it's any part of the actual flower, because the chrysanthemum is a flower, or it's in any of the products that we saw on the slides discussed earlier. And then obviously the larger the quantity that they ingest, the higher the health problem will be. And so, how can I tell if my dog has pyrethroid poisoning? Basically the symptoms will develop pretty quickly, most likely within the first hour after they ingest it. And some of the symptoms include vomiting, tremors, and seizures, difficulty breathing, profuse drooling, weakness, tearing in the eyes, and diarrhea. And then for the more severe cases of poisoning, they may show signs of depression, fever, low body temperature, disorientation, and respiratory failure, which can be followed by death. And my dog, we didn't know right away. He just started vomiting, and he had excessive drooling, and he actually ended up going into seizures. So that was when my dad, he called the vet, and at that point the vet was like, well, we really can't do anything. We can't induce vomiting because we don't want to risk dehydration. So if you can actually get water into him so he can start getting fluids into his system, that would be the best. But it was kind of just a wait and see type game, which is never like awesome to hear, but I had faith that he would make it. So how pyrethrins and pyrethroids work and affect the body. So the molecular target of the pyrethrins and pyrethroids are similar in mammals and insects and include voltage-gated sodium, chloride and calcium channels, GABA-gated chloride channels, nicotinic ACH receptors, and intercellular gap junctions. And then, And then, so for type 1 pyrethroids, they produce a neurological syndrome through their CNS and PNS effects. And that's when you get the tremors, the incoordination, seizures, and sometimes death. And then type 2 pyrethroids work primarily by CNS mechanisms to elicit the
Point to it.
And salivation syndrome, which is characterized by hyperactivity, hunchback, salivation, tremors, and incoordination progressing to sinuous writhing movements. And so here's kind of
Go ahead.
here's kind of a little clip that kind of touch bases on what I just said. It's kind of a longer clip and it goes into the detail, but really the last, like 30 seconds are,
The essence of.
yeah. We'll start there.
Neuron level. Pyrethroid-treated neurons exhibit uncontrolled firing and neurotransmitter release with eventual hyperdepolarization of the membranes and ultimately loss of electrical activity. The initial hyperactive nerve firing and neurotransmitter release affects nerves and muscles throughout the body of treated insects, resulting in early twitching and convulsions followed by paralysis and death.
Okay.
Commonly used commercial pyrethroids include permethrin, cypermethrin, and alethrin.
Alright, so that was kind of the gist of what it does, how it affects the neuron and affects insects, which it does the same thing to, like your dogs, if they get enough in their system. So to diagnose this, typically your veterinarian can do a blood test, or they can do urine samples, or you can just describe the symptoms and hopefully they can figure it out based on what you've described to them. And if you do know what they've gotten into, they may ask you to provide the package that they got into. And then for treatment, you can give, veterinarians can administer quick and effective treatments with decontamination, typically bathing and liquid dish soap. And that was actually for like cats and stuff. They'll get it with like flea collars, or if you administer flea and tick treatments weirdly, it can affect them. So that's why they say bathing.
Because you're gonna wash it off then.
Yeah. And then you can give them the anti-seizure drugs, muscle relaxants, temperature monitoring, blood work. And then you can also give them IV fluids, because if they've been vomiting profusely, then they're going to be dehydrated. And the earlier the treatment, pretty much the better the prognosis, assuming the dog doesn't develop further complications secondary to neurological signs. And then if the dog does develop neurological signs that can't be controlled, or develops clotting problems, or kidney failure, to severe seizures and hypothermia, the prognosis is typically poor. And basically for prevention, make sure you read the directions on any product that you use that contains chrysanthemum. Be cautious about the number of different flea and tick products that you use on your dog. Use the appropriate sized product for the weight range of your dog. And then basically keep anything out of reach that contains this that you don't want your animal or pet to get into and you don't know. And then if they do get into it, you can call Pet Poison Helpline if need be. It's a good number to have handy if you have pets. And then store your insecticide products out of reach. And that's the dog that ended up getting into the bag.
Okay, now, did you ever tell us, did the dog survive? I can't remember.
He did. He's actually 10 years old. And
Okay, good.
He survived numerous. That's my sources.
Let's give her a round of applause. That's great. Questions?
Yeah.
Here's a question over here.
So if the animal ingested is not necessarily like an antidote or anything, it's kind of just like a waiting, that's kind of what I was getting from it, like they're not necessarily anything to get them to
Yeah, so
reverse
she,
that.
so she asked if there was like an antidote for this issue. There's not. You can really only treat the symptoms for this. Like I said, it depends on how early you can catch it. I didn't catch the symptoms early enough, or like what had been going on, so at that point he was seizing and drooling. And
So how many hours do you think it was by the time from, I mean, you probably don't know when you ate it, but
I think it was about like 2 hours.
2 hours.
So probably like an hour earlier would have been even better.
Have you noticed any like long-term health issues as a result from this? Like any slowness as a result? Because I know at least they said that some of the neurons died.
So the question was there any like long-term effects of this incident? No, not that I know of. He's still.
there might be in some animals, you never know. It's a case by case basis. One more question.
In terms of
So she was talking, or the question was like, whenever doing decontamination, should we wear gloves? Is it an issue or health concern for us? Not really. Like we can absorb it through our skin, and if you want to wear gloves, I mean, it wouldn't hurt, but we would have to absorb a very high dosage because it's in a lot of things that we use.
Depends on the product and how strong it is, but yeah, here's what you gotta always remember, things do get absorbed through the skin, and it's better to be careful. And the drooling is really quite a hallmark characteristic for insecticide poisoning. Maybe next week I'll show you, somebody sent me a cow that was really drooling, and they wanted to know what my guess was. That's all they didn't even tell me any history or something, and I went back and go, how they got into some insecticide, I mean, profusely. You got your assignment, it's not due Monday, it's due Wednesday. I sent that email because I flubbed up and I didn't post it.